In this cool sculpting procedure training video, we will discuss how to use the vacuum applicator on the flank. Topics include how to assess the flank, plan the treatment with markings, place the applicator, and position the patient. For the right candidate, the Cool Curve Plus applicator is preferred for treating the curve of the flank, but a cool core may also be used. Determine the best fit by using the applicator planning templates. For consistent, aesthetically pleasing outcomes, patient selection and the assessment process are essential. The goal for treatment of the flank is to accentuate the hourglass shape of a woman. The ideal outcome for a man is to define or create a V shape. To determine if the patient is a candidate for treatment, pull fat away from the body, forming a C shape with your hands to see how much fat can be drawn into the vacuum applicator. If the patient does not have tissue that can be pulled into the vacuum applicator, they are not a candidate for treatment of the flank. Here is what you can expect when following the recommended treatment protocols. On the treatment day, the patient should wear disposable shorts. Document their weight and take baseline 360-degree photos using the foot positioning guide. When taking photos of the flank, the patient's hands should be at a 90-degree angle resting on their elbows. To begin the assessment, ask the patient to stand so that their weight is evenly distributed on both feet. Their arms should be crossed with hands gently resting on their shoulders. The most narrow part of the waist will separate the lower and upper flank. To accentuate the hourglass shape on a woman, look for treatment opportunities on the lower and upper flank. To create a V shape for the male, treat below the narrow part of the waist. Pull tissue away from the body to determine how much fat can be pulled into the vacuum applicator, and use the applicator planning templates to identify the best applicator for treatment. It is common for the flank to be asymmetric. Discuss the differences in fat distribution with the patient, as it will affect the marking and placement of the applicator. Before marking the patient, wipe the treatment area with alcohol to remove excess oil or lotion from the skin. Find the narrow part of the waist and, starting at the lower flank, mark where the fat tapers, posterior to anterior. The applicator placement will be between those two lines. Find the natural orientation of the bulge and align the cooling panel on the applicator planning template to the posterior marking on the patient. Draw a line from one end of the template to the other, extending the line 1 inch or 2.5 centimeters on both sides. Mark the end of the template to help position the applicator at the correct angle. Mark the cooling panels to identify the area that will be treated. Remove the applicator and extend the cooling panel lines. Using a different colored marker, find the natural orientation of the bulge. Align the cooling panel on the applicator planning template to the anterior marking and mark the treatment area. The cooling panels on the template should meet both the posterior and anterior markings. This will likely require more than one application with an overlap of the cooling panels. Use different colored markers to better define the treatment area. Step away and visually assess your markings to confirm complete coverage. Consider taking photos after your markings are complete. To prepare the patient for placement of the applicator, they should stand near the treatment bed. Use an absorbent pad over their shorts to capture residual gel during placement. Center and gently drape the gel pad between the two cooling panel markings, and working from the center outward, Use the back of your fingers to smooth the gel pad and eliminate wrinkles and air bubbles. Recommended settings for the vacuum are 60, 75, and 60. Engage the vacuum and apply the applicator straight on following the treatment markings. Do not rock or roll the applicator into place. The patient will feel sensations of deep pulling, tugging, and pinching as the applicator draws the tissue. Verify that the gel pad is extended past the applicator's cooling panels and check to see if there is sufficient draw. To deliver therapeutic cold to the treatment area, tissue must make contact with the cooling panels. Maximum tissue exposure to the cooling panels will result in a greater opportunity for fat cell death. To loosen tissue and improve tissue draw, consider using one or more of the following techniques. Administer a manual massage to the treatment area. Apply the vacuum applicator for 3 to 5 minutes without initiating cold. Remove the applicator and gel pad, then replace with a new gel pad and reapply the applicator. Use a warm, wet washcloth over the treatment area. Once you have confirmed sufficient tissue draw, help the patient get into a reclined position on the treatment bed. Use pillows to support the applicator and help the patient get comfortable and secure the applicator in the support arm. Cover the patient with a blanket and engage cooling. Common side effects include an intense cold, tingling, stinging, aching, and cramping as the cooling begins. These sensations generally subside as the area becomes numb. To enhance the experience, provide the patient with water, snacks, and reading materials. Stay with the patient for a few minutes after cooling has initiated, and check on the patient periodically during treatment. Return to the room before the treatment ends and talk to the patient about what to expect during the applicator removal process. Immediately after cooling has ended, turn off the vacuum. Release the vacuum seal by sliding your finger between the patient's skin and the edges of the applicator cup. Remove the single-use gel pad and begin to administer a 2-minute massage. Begin the post-treatment massage immediately after the treatment ends to manipulate the fat cells when they are at their most crystallized state. In the first minute, vigorously knead the treatment area. In the second minute, apply a deep pressure massage in a circular motion. The same person should administer the massage on both sides for consistency. Before the patient leaves, wipe the residual gel from the treatment area and remove markings using alcohol and a gauze sponge. Educate the patient on what to expect after treatment. In the days and weeks following treatment, the patient may experience redness, bruising, swelling, tenderness, cramping, and aching. Sensations of itching, skin sensitivity, or numbness can last several weeks after treatment. These sensations are normal, but instruct them to contact you if they worsen over time. Patients may begin to see results in as early as 3 weeks, but will experience the most dramatic results between 1 and 3 months. Bring the patient back after 30 days for a follow-up medical assessment to review results, reassess, and determine if additional treatments are needed. Treatment of flanks may take more than one treatment session, so set expectations with your patient during the consultation. With a variety of applicators, the Cool Sculpting system allows you to create customized treatment plans to fit the individual needs of your patients. The Cool Curve Plus and Cool Core applicators are preferred for treatment of the flank. For ideal patient outcomes, assess the treatment area while the patient is standing. Identify where the treatment begins and ends. Use applicator planning templates to mark the treatment area. Ensure the cooling panels on the template meet where the tissue begins and ends. Apply the single-use gel pad. Engage the vacuum and apply the applicator following the treatment markings. Seat the patient in a reclined position. Initiate cooling only after the patient is comfortable. Immediately after cooling has ended, administer a 2-minute manual massage. To make the Cool Sculpting procedure successful in your practice, properly educate patients on what they can expect during and after treatment. Deliver transformational results by performing a 360-degree assessment and developing a customized treatment plan. Provide the patient with a positive experience by creating a relaxed and welcoming environment. Stay tuned. At the end of this video, we will show you a complete assessment of the lower and upper flank, as well as demonstrate how to properly place for simultaneous treatment of the flank and abdomen. Thank you for partnering with us. We look forward to helping you make the cool sculpting procedure a success in your practice. Results and patient experiences may vary. During the procedure, the patient may experience deep pulling, tugging, pinching, numbness, or discomfort. Following the procedure, typical side effects include temporary numbness, redness, swelling, bruising, firmness, tingling, stinging, and pain. Rare side effects may also occur. The cool sculpting procedure is not for everyone. Patients should not have the cool sculpting procedure if they suffer from cryoglobulinemia or paroxysmal cold hemoglobinuria. The cool sculpting procedure is not a treatment for obesity. As with any medical procedure, a consultation should be done by a licensed physician to determine if the patient is a candidate for treatment. Consult the Cool Sculpting System user manual for a complete list of contraindications and potential side effects. Treatment applications that deviate from the guidelines are not recommended.